Welcome back to the Doberman Dialogues. I'm Brittany.
And I'm Liam. Today we're tackling an important topic that affects many dog families, diabetes in dogs, and specifically what it looks like in Doberman Pinschers, how to recognize the signs, practical day-to-day care, including how to give an insulin shot, and a look at continuous glucose monitoring tools that make life easier, like the FreeStyle Libre system.
Before we dive in, just a quick note. A&M Web Designs decided to make this episode because a Desert Harbor Doberman rescue of Arizona foster family is currently caring for a diabetic Doberman. Their experience navigating diagnosis, insulin, and monitoring inspired us to share what they have learned with other Doberman lovers. Thank you to that foster family. Your openness made this episode possible.
Yes, we certainly appreciate them sharing the information they have learned with us.
We would also like to add that neither we, our production team at A&M Web Designs, the foster family, nor the Desert Harbor Doberman Rescue of Arizona are veterinarians or medical professionals. The information shared in here is for general informational purposes only and should not replace professional veterinary advice, diagnosis, or treatment. If your dog is sick, diabetic, or showing symptoms discussed here, please consult your licensed veterinarian for personalized care and recommendations.
Thank you, Brittany. Okay, let me start with the basics. Diabetes mellitus in dogs is a condition where the body cannot regulate blood glucose properly due to issues with insulin production or utilization. This is most often similar to type 1 diabetes in humans, meaning that affected dogs require insulin therapy to survive and thrive. According to the American Kennel Club, the condition is typically managed through insulin injections, as dogs with diabetes are often insulin dependent, just like humans with type 1 diabetes.
The veterinary teaching hospital at Cornell University also notes that the onset of diabetes in dogs is generally gradual, occurring over weeks to months rather than overnight, with symptoms like increased thirst, frequent urination, weight loss, and recurrent infections, and also becoming lethargic, which develops progressively. This aligns with the Merck Veterinary Manual, which highlights that the condition usually results from a failure of the pancreas to produce adequate insulin and that symptoms appear gradually. Early diagnosis and proper treatment are essential to managing the disease effectively.
Research and breed data from veterinary sources, including the Merck Animal Health Companion Animal Manual, WebMD Pets, and peer-reviewed studies, suggest that some dog breeds may have a higher than average risk of developing diabetes, often due to genetic predisposition. Let me add that peer-review studies refer to research that has been carefully evaluated by experts in veterinary medicine to ensure its accuracy, scientific rigor, and reliability before being published. These studies help confirm that certain breeds may be more prone to developing diabetes, although any breed or mixed breed can be affected.
Besides Dobermans, the miniature Schnauzers, Poodles, and Beagles are also considered to be at higher risk for diabetes.
That's right, but remember, diabetes can occur in any dog breed. So if your dog has a sudden change in drinking, urination, appetite, or energy level, don't blame it on age alone. A quick vet visit and some blood work can catch diabetes early and prevent complications.
That's right, Liam. If you're a Doberman owner, it's important to stay vigilant and watch for signs of diabetes, as the breed's higher risk makes it worth being especially alert.
Okay, so one more time. Here are the specific symptoms to watch for, and we'll include a few of the medical names.
Polydipsia, which is drinking a lot. Polyuria, which is peeing a lot. These are classic symptoms of diabetes in both humans and dogs. High blood sugar leads to the kidneys filtering out more glucose, which in turn pulls water into the urine, causing increased thirst and urination.
Polyphagia, which means eating a lot. This occurs because the body is unable to properly use glucose for energy, prompting the dog to feel constantly hungry.
Then there is weight loss despite a good appetite, or an increased appetite. Even though the dog may be eating a lot, it loses weight because the body cannot utilize the glucose for energy properly.
So instead, the body starts breaking down fat and muscle for fuel, leading to weight loss.
That's right. Then they can become lethargic, which is another common symptom in diabetic dogs. Their body isn't efficiently using glucose for energy, leaving them tired and weak.
And recurrent urinary or skin infections. Dogs with diabetes are more prone to infections, especially urinary tract infections and skin infections. High blood sugar can impair immune function and create an environment conducive to bacterial growth.
In emergencies, diabetic dogs can develop diabetic ketoacidosis, also known as DKA. A small amount of ketones in urine can occur if an animal hasn't eaten recently, but high levels can signal the onset of DKA.
Now, this would be considered a medical emergency that requires immediate veterinary care. It's a life-threatening state where the dog becomes weak, stops eating, vomits, breathes fast, and can become unresponsive.
Exactly. So, if your dog is showing these symptoms or you suspect DKA, get to an emergency vet right away.
Most definitely.
So, in order to diagnose for K9 diabetes, veterinarians will recommend a fasting blood glucose test. That means your dog skips food for about 8 to 12 hours beforehand, but water is always allowed. Fasting helps make the results more accurate because eating can temporarily raise blood sugar.
Some tests, like the fructosamine test, don't require fasting since they show average glucose over several weeks. Your vet will guide you on whether fasting is necessary based on the type of test and your dog's health.
Your vet will most likely order a urinalysis to check for glucose in the urine too. From the start, treatment most commonly includes insulin injections and dietary management tailored by your veterinarian. Regular follow-ups are crucial.
That's right, Britt. Many vets will schedule an initial string of checks, glucose curves or frequent blood checks, to find the right insulin dose. But there are newer tools that reduce frequent pokes and clinic visits. Continuous glucose monitoring systems like the FreeStyle Libre 2, which we'll discuss in a bit.
According to the American Animal Hospital Association and the Merck Veterinary Manual, once diabetes is confirmed, the mainstay of treatment is insulin therapy combined with dietary management that's customized by your veterinarian. For dogs like Dobermans, this often means twice daily insulin injections and a consistent, balanced diet, typically one that's higher in fiber and helps stabilize blood sugar levels throughout the day.
Perfect. And remember, like Brittany said, regular follow-ups are very important. Your vet will monitor your dog's glucose control, adjust insulin doses as needed, and watch for any complications. With the right care and consistency, most diabetic Dobermans can live long, active, and happy lives. Okay, so let's talk about how to give your dog an insulin injection.
But first, an important safety note up front. Always follow the specific instructions from your veterinarian about insulin type, dose, and schedule. Different insulins in dogs need different regimens.
It's also a good idea to have an assistant to help you. Someone who can keep the dog's attention on them while you inject the insulin. Although one person is able to do the injection, it makes it a lot less stressful on everyone.
That's a good call out, Liam. You can have an assistant talking to the dog, giving them a small treat or peanut butter.
So with that being said, here's a veterinarian-approved, generalized step-by-step technique for subcutaneous insulin injections that you can practice at your vet's office.
Okay, so first, prepare the supplies. Get your insulin in its syringe or the vet pen, alcohol wipes, sharps container for needles, and a small reward for your dog. Keep insulin refrigerated as directed. Make sure to gently roll the vial between your hands to mix it. Avoid shaking it, as this can create air bubbles. Your vet will instruct you on how to drop the correct dose of insulin into the syringe.
Next, wash your hands and have the dog calm. This is where an assistant would be useful in case your dog is anxious. If your dog is a little anxious, then wrap them in a towel or have your assistant gently hold them steady while keeping the dog's attention on them.
This is where talking to your dog helps them to keep calm. And make sure to choose a consistent injection spot each time. Many owners rotate between the scruff and the flank, but don't use more than 2 injection points.
Good point, Britt. Now pinch the scruff of the neck, the loose skin between the shoulder blades. With one hand, gently lift and pinch a fold of loose skin between your thumb and forefinger to tent it. The scruff is commonly used because it has a good layer of subcutaneous tissue.
Then insert the needle. Hold the syringe or pen like a pencil in your dominant hand. Insert the needle quickly at a slight angle into the base of the tented skin. Aim for subcutaneous space, not deep muscle. For pen devices, follow the manufacturer's instructions for needle length and technique.
And deliver the insulin. Press the plunger steadily or press the pen button to ensure the full dose goes into the tissue. Some veterinarians recommend keeping the needle in place for an extra couple of seconds after injecting.
This is because it helps reduce what's called leak back, which happens when some of the insulin leaks out of the injection site instead of staying in the tissue. By holding the needle in place for a second or two longer, you're making sure the insulin is fully absorbed, which helps make sure your dog gets the correct dose. This tip comes from various veterinary practices, including advice from sources like the Merck Veterinary Manual and the Veterinary Partners website.
And, of course, withdraw and reward. Remove the needle and massage the injection point. Make sure to dispose of the needle immediately in a sharps container. Make sure to praise your dog and give them a treat, if you or your assistant haven't already been doing that. Make sure to keep a log of dose and time. If the dog flinches and blood appears, apply gentle pressure with a clean tissue. If you see persistent bleeding, contact your vet.
Practice with your vet the first few times. Many clinics will show you the technique and watch you give the injection before you leave. And it really becomes routine. They will probably use a saline and have you do actual injections.
That's right, and another thing. The scruff is a common site to inject because it's easy to access and dogs typically tolerate it. But some dogs might prefer flank injections. Do what your vet recommends for your dog.
Now let's talk about the tech that's changed life for so many diabetic dogs and their caregivers.
I've been excited to talk about this part.
Yeah, me too.
We are talking about the FreeStyle Libre product called Continuous Glucose Monitoring System, or the CGM system, made by Abbott.
That's right, Liam. This is an amazing tool that can help eliminate undue stress for both the dog and their caregiver.
That's right, Brittany.
Just so you know, the FreeStyle Libre devices were designed and approved for humans. But what's really interesting is that this same setup has started making its way into veterinary care. Veterinarians use them off-label in pets. The studies and real-world results show they're accurate and incredibly helpful when the data is interpreted properly. In fact, one of our foster families has used the Libre system under a vet's supervision. And our veterinarian was actually able to monitor the dog's glucose levels in real time through the Libre View platform. Abbott's companion app, Libre LinkUp, even lets caregivers or fosters get those same readings and alerts instantly on their phones.
The way it works is that a small sensor is placed under the pet's skin, usually by a veterinarian, but the pet's guardian can do it as well, with proper vet supervision. And it measures interstitial glucose every few minutes for up to 14 days, depending on the model. You can scan the sensor using a smartphone app or reader to see the current glucose levels and trends without drawing blood.
According to the American Animal Hospital Association, systems like the FreeStyle Libre can collect glucose data every 15 minutes and provide detailed curves that help veterinarians fine-tune insulin therapy.
Exactly. The company behind the FreeStyle Libre family of continuous glucose monitors, Abbott, has a whole set of apps like the FreeStyle Libre Link, Libre 2, and Libre 3 that show real-time glucose readings and trend graphs right on your phone. According to Abbott Diabetes Care, those apps sync with LibreView, their cloud-based platform, so doctors can review glucose data remotely.
And for clinics using LibreView professional accounts, that means the vet can check a dog's glucose data between visits, so there's less need for those stressful clinic visits for glucose checkups and more continuous insight to fine-tune insulin doses.
It's a data-driven approach that, according to Abbott Diabetes Care and the University Animal Clinic blog from 2024, many vets have called a real game-changer for managing diabetic dogs and cats. Always work closely with your veterinarian when using the CGM systems. They'll make sure it's placed in the optimal location, readings are interpreted safely, and your dog stays comfortable. That is also recommended in the American Animal Hospital Association guidelines and the Merck Veterinary Manual.
Yes, please don't try using the FreeStyle Libre system without guidance from a licensed veterinarian. Your vet will know how to interpret the readings and make sure it's safe and effective for your dog.
And the best part about this system? This technology has transformed life for diabetic dogs, cats, and their families and guardians. Instead of constant poking, blood draws, and stressful clinic visits, caregivers can now track their dog's glucose trends in real time. Make informed adjustments with their vet's help and keep their pups happy, active, and thriving.
Some of you might ask if it hurts the pet when the monitor is put on. The FreeStyle Libre sensor does have a small needle that's used to insert the sensor just under the skin. Yes, your dog will feel that quick poke when it's applied.
But it's a one-time poke, and once the needle is removed and the sensor is taped in place, they don't feel a thing. After that, it just sits comfortably on the skin, quietly recording data.
It's amazing to see how far veterinary technology has come, giving dogs with diabetes longer, healthier, and more comfortable lives.
That's for sure. So here's what a typical workflow looks like. The sensor is first placed on the pet. It's a small disc with a tiny, flexible filament that sits just under the skin. As Brittany said, there is a needle in the middle of the disc, which is to insert the filament. Over the next 14 days, that sensor automatically reads interstitial glucose about every 15 minutes. The caregiver simply scans the sensor with their phone's Libre app or reader to see current glucose levels and trends, whether they're going up, stable, or dropping. The app can also upload data to LibreView whenever the phone's connected to the internet, which allows veterinarians to review those reports remotely and adjust insulin doses as needed. It's a huge quality of life improvement for many families.
Exactly. The app constantly displays your dog's current glucose level, as long as the phone with the app is within range. But since dogs don't exactly carry phones in their pockets, the connection can drop when they head out to the yard or another room. Don't worry though, the sensor stores several hours of data on its own. Once you scan again, it uploads everything and fills in the gaps automatically. So you'll still get a complete glucose report.
That's such a great feature. Just remember, these sensors are single-use and worn for their approved duration. Again, 14 days. The app also has a countdown, so you know exactly how many days are left on the sensor's life. Your vet can show you placement sites, how to prep the area, how to protect it, and what the costs look like.
Another cool thing about the Libre, and something we definitely recommend, is that you can add notes directly in the app. That way, when your vet reviews the reports, they can see what was happening during the day.
That's a great idea. It really helps your vet understand what might have caused a spike or a drop in glucose.
Exactly. You can log when and how much your dog ate, how much insulin you gave, and at what time, and even when you went for a walk or played outside. One more quick tip. It's usually best to give insulin after your dog eats, so you know they've had food on board before the dose.
That is a good call-out, Brittany, and important too. All right, so remember our foster family we mentioned earlier? Here's a short explanation of their experience. And yes, we have their permission to share this story. So, Brittany, tell us what they did and what it was like.
Thank you, Liam. So Klaus, the foster Doberman in question, was surrendered to the Desert Harbor Doberman Rescue of Arizona at the end of October 2025. When he arrived, he was in pretty rough shape. They took him to the Cactus Pet Hospital in Phoenix, where Dr. Suni had to drain his front leg. It was badly swollen and full of infection. The rescue had originally booked him just for a neuter appointment, but once they saw how sick he was, the team prioritized his leg and ran some blood work to figure out what was going on.
I'm sure they were worried it could be something serious. Valley fever, osteosarcoma, or possibly diabetes.
Yes, they certainly were. He was panting heavily, drinking a ton of water and not eating or playing like a healthy 6-year-old Doberman should. Since Dr. Suni is primarily a surgeon and her internal medicine specialist was away, Klaus was taken to Dr. Center at Central Mesa Veterinary Hospital for further testing. Dr. Center kept him for the day, ran additional blood work, and confirmed the diagnosis: diabetes mellitus. Klaus started insulin that same day. Naturally, the foster family was worried about how often they'd have to bring him in for blood tests due to those painful glucose checks. That's when one of the rescue's volunteers and Dr. Center mentioned trying out a FreeStyle Libre continuous glucose monitor, or CGM, which they'd both knew about. Also documented in the Merck Animal Health and the AAHA Diabetes Management Resources. Unfortunately, Dr. Center didn't have a Libre 2 sensor in stock, so the Desert Harbor Doberman Rescue volunteers ordered one. When it arrived, the foster family and a Desert Harbor volunteer, who also had vet tech experience, placed it on Klaus under Dr. Center's guidance. So first, they shaved a small spot on Klaus's shoulder and cleaned it with an alcohol wipe. Then, they took the sensor and applied it to the shaved and clean spot. Like we stated before, the sensor looks like a little white disc with a needle in the center and adhesive tape around it. It was clear that Klaus felt that quick poke. Even with peanut butter as a distraction, he flinched a bit, but he was okay. The peanut butter helped. Once the needle was out and the sensor was in place, he was fine. They covered it with the protective bandage that came with the sensor. Once that was done, they opened the Libre app, followed the simple setup steps, and scanned it with their phone. And just like that, they got their first glucose reading. From then on, they were able to see continuous glucose trends and share the data directly with Dr. Center. That made dose adjustments much easier and dramatically reduced the number of trips to the vet for glucose curves. The foster family said the biggest lesson was routine, feeding at the same times for morning and evening, making sure to give insulin right after his meals, and scanning when they would lose contact due to the phone not being close enough to the sensor at all time, and making sure everything was done consistently. That steadiness made a huge difference in Klaus's recovery. When they were done, they put a tactical vest harness on Klaus for added protection to the sensor when he laid down.
Once again, we'd like to extend a huge thank you to our amazing foster family for taking on this task. We hope that their willingness to help and share their story inspires other families that are caring for diabetic pets.
And a big thanks to the Desert Harbor Doberman Rescue of Arizona for rescuing Klaus. Klaus has come a long way and is now healthy and happy. He's running around the yard, goes to the park, loves to go to the store, and really loves his nap time in the middle of the yard. He's ready for a forever family to adopt him so he can make them happy.
That story really highlights what so many vets and dog caregivers, including the folks at Merck Animal Health, emphasize when managing diabetes at home.
It certainly does. Here are some quick, practical tips that work. Keep everything organized. Store insulin, syringes, or pens, and a sharps container together in a secure, cool spot. Feed at consistent times relative to insulin injections. Log those feeding and injection times and note it in the app for the vet to review. Track the details. Record doses, meals, extra treats, and exercise. All of those affect glucose levels. Use the CGM trends. Look for patterns like overnight lows or post-walk spikes. Your vet can see those patterns too through the shared app data. Stay prepared. Keep your vet's contact info and the nearest 24-hour emergency clinic number in your phone and wallet.
Following these simple routines can make a huge difference, not just for glucose control, but for your dog's comfort, confidence, and overall quality of life.
That's right, Liam. Now let's answer some common questions. Can a diabetic dog live a normal life? Yes, of course they can. With good insulin therapy, consistent diet, and monitoring, many diabetic dogs live happy, active lives for years. Early diagnosis and a good partnership with your vet are key.
How often do you have to inject their insulin? Most dogs get insulin twice daily, but the exact dose and schedule depend on the insulin type and your dog's response. Never change dose or schedule without your vet's guidance, and be consistent on time of day for the injection.
What about home glucose monitoring? Home blood glucose meters and CGMs both have roles. CGMs reduce frequent skin pokes and provide trend data. Home meters are still useful for spot checks, especially if the dog is showing symptoms that don't match the CGM reading. Your vet will tell you which combination suits your dog.
If you leave with one thing, let it be this short checklist.
Watch for increased thirst, urination, appetite, and weight loss. If diagnosed, work closely with your vet on insulin dosing and schedule. Learn and practice the injection technique with your vet. Scruff is a common, well-tolerated site. Ask your vet about CGM, FreeStyle Libre, and data sharing, LibreView, and Libre LinkUp to cut down on clinic visit stress and ability to get continuous insight.
Thanks, Brittany. That was some great info. And also a big thanks again to the Foster family who inspired today's episode. Your efforts not only helped Klaus but gave many owners peace of mind by sharing your experience.
And just a reminder, we're not vets, and we don't pretend to be. Everything here is for information only and has been offered from our foster family's experiences and research from reputable sources.
That's right. So, always check with your veterinarian about what's right for your dog.
We've listed the most helpful sources and vet resources for this episode: veterinary manuals, guidance on injections, and FreeStyle Libre documentation in the description too.
And if you have questions, or if your dog is diabetic and you'd like to share what you have learned from the experience, we'd love to hear it. Please feel free to share in the comments.
Yes, please do. We'd love to hear from you.
We'd like to thank all of you for tuning in and listening. Please don't forget to subscribe, like, and share our channel with your friends and family. And if you are interested in adopting or fostering a Doberman in Arizona, you can reach out to our friends at the Desert Harbor Doberman Rescue of Arizona's adoption team.
This is Brittany
and Liam
for the Dobie Foster Friends A&M Web Designs and the Desert Harbor Doberman Rescue of Arizona, saying, stay sharp, stay loyal, and never underestimate the heart of a Doberman. With that being said, please give your Dobie a belly rub from us, and remember, behind every strong Doberman is an even stronger bond. See you next time.